So hello once again. So this discussion is still on the equipment that could be used to monitor the hemodynamic status of our patient. Among the equipment there that are used is what you refer to as your capnography. When I say capnography, dear students, it could continuously assess your respiratory gases. Guys, if you can recall your lessons in fundamentals of nursing, we have what we refer to as your arterial blood gas. May tinatawag tayo class na ABG or arterial blood gas. When I'm talking about your arterial blood gas, the following components are being evaluated in your arterial blood gas. Ano po yung mga components na tinitingnan natin in arterial blood gas? So you have your pH, you have your PaCO2, and then your HCO3. Class, when I say PaCO2, that's the partial pressure of your carbon dioxide. Again, klasa, when I say PaCO2, that's the partial pressure of your carbon dioxide. Pag sinabi natin guys na partial pressure of carbon dioxide, the normal value of that in our bloodstream is 35 to 45 millimeter mercury. Okay, 35 to 45 millimeter mercury. Now guys, if there will be an increase, if there will be an increase of your PaCO2, the tendency is that the body will become acidotic. Whenever there will be a decrease of your PaCO2, pag magdi-decrease po yung PaCO2 natin, tawag naman natin dyan is that your body would become alkalotic. Now, if you would look at this equipment being referred to as capnography, ang tinitingnan niya po is the PaCO2 levels in our bloodstream. So, if you would look at the cardiac monitor again, this is still a cardiac monitor, the cardiac monitor that we have been repeatedly discussing. So, class, ang makikita niyo po dito, okay, here, that is where your PaCO2 is. So, that means, class, that your monitor could continuously assess the PaCO2 levels of the patient. Sir, anong gagawin natin kapag mataas yung PaCO2 levels? Class, pag mataas yung PaCO2 levels, may ina-adjust po yung mga doctors natin sa ventilator ng patients. Sa mga hindi pa nakakaalam kung ano yung ventilator, plus if you have seen life support, if you have seen in movies, kung nakikita po ninyo sa movies yung ginagamit for life support, let's see, magpakita tayo, mag-search ng ventilator. Okay, plus this is how your ventilator looks like. Okay? Tapos, di ba, makikita nyo yung pasyente, usually naka-attach po yan sa tube. Okay? Pagkatapos po, that very machine will be able to allow your patient to breathe. Okay? Hindi lang po breathe, to release the carbon dioxide and to allow oxygen to enter. So, pag nakita po natin na mataas po yung carbon dioxide, ano pong isa natin ginagawa? That is for your doctor to modify the settings of your ventilator to allow carbon dioxide to go out. Now, how about naman class pag mababa yung carbon dioxide natin? A very good example class ng pagbaba ng carbon dioxide natin is what you refer to as your hyperventilation syndrome. Okay? Acute lang to class ha. This is an acute decrease of your carbon dioxide levels. Halimbawa, di ba, Valentine's. Pagkatapos ng Valentine's, akala mo magka-date kayo. Pagkatapos, hindi siya nagyayang mag-date. Pagpunta nyo sa dating tagpuan ninyo, na-shook ka na lang, ibang babae na yung kasama niya. Okay? Or baka iba na yung partner niya. Huwag nating sabihin lalaki or babae. Iba na yung partner niya. Okay? So anong mangyayari sa'yo? Iiyak ka, di ba? Alam niyo yung feeling na umiiyak pero walang boses? Have you seen that or have you been through that? Di ba? Sakit. Okay? Tapos anong mangyayari? Naninigas yung mga extremities mo, di ba? Di ko magalaw ang kamay ko, ang sakit ng ginawa niya sa akin. Plus, that's an example of your hyperventilation syndrome. Okay? Yung grabe yung iyak mo, grabe kabilis yung paghinga mo, class, pagkatapos mamaya, stiff. You became stiff. That is your hyperventilation syndrome. Kung may capnograph ka sana, by the time na nagka-heartbreak ka, makikita mo, class, na bumaba yung PaCO2 mo. At dahil bumaba yung PaCO2 mo, class, okay lang, cheap lang pong treatment niyan, ha? Bumili ka, class, or wag ka nang bumili, pumunta ka na lang sa restaurant, tapos humingi po kayo ng tinatawag natin na brown paper bag. Okay? Humingi po kayo ng brown paper bag. Hindi po para magsuka, pero doon po kayo mag-inhale, exhale sa brown paper bag. Anong purpose ng brown paper bag, guys? Ipapa-increase niya yung carbon dioxide mo. Kaya ipapa-increase niya yung carbon dioxide mo. Okay? So that's why yung mga todong iyak dyan dahil sa heartbreak, kung bakit kayo naninigas, that's because of the decrease of carbon dioxide in your body. So again, para mag-increase yung carbon dioxide, brown paper bag na naka-seal, dapat sealed po. Imagine may brown paper bag ako dito. Pagkatapos inhale, exhale, paulit-ulit lang. Okay? So class, that's one importance of carbon dioxide on your body. On your end naman, on the use of this technology, you closely monitor the carbon dioxide levels for us plus to determine the need of your patient. No? It's our basis for the respiratory need of our patients. Okay? So plus, this is not a technology that I can tell you na common to abroad. Hindi lang ito common abroad. Plus ginagamit na natin ito ngayon. Now, next is to continuously evaluate your glucose levels. If you can recall, in fundamentals of nursing, isa sa mga basic procedures na tinuturo namin is ang tinatawag natin na CBG. Who can tell me what CBG is? Ano po yung ibig sabihin ng CBG, guys? Okay? Ano po yung ibig sabihin ng CBG? Sige, keyboard warriors, sa mga hindi nakapagfunda pero nandito ngayon.
Capillary blood glucose monitoring.
Okay, very good. So plus your CBG stands for your capillary blood glucose. Okay, capillary blood glucose. Okay, yan po yung usual na ginagawa. Ito po si capillary blood glucose. Nandito po siya sa pinaka-right ng ating video. So guys, ano pong ginagawa natin sa capillary blood glucose monitoring? Nakikita nyo to sa hospital, nagpiprick po tayo. Pagkatapos ito pong blood, okay, actually by procedure, the first drop of blood is actually discarded. No? Yung first drop of blood, i-wipe nyo po dapat ng cotton balls. Pagkatapos yung next drop ng blood po, kay ilalapit ko po ito papunta dyan, tapos i-collect po natin. Tapos magre-reading yan. Ano po ang normal values ng ating capillary blood glucose? Ano po yung normal values ng capillary blood glucose natin? Anybody?
Concentration between 70 mg per milliliter, sir.
Okay, 72
and 100.
Okay, so it's 70 to 100 milligram per deciliter. Very good, no? Other institutions class are using the reference 80 to 120 milligram per deciliter. So with that, no, pwede nating sabihin that the normal value is playing at 70 to 120 milligram per deciliter. Ito, by textbook to. Pero later on, kung nasa hospital kayo, magtanong-tanong lang po kasi frequently, nag-a-update yung Society on Diabetes. Now, if the patient's blood sugar is less than 70, sila po yung pasyente mo na namamawis, okay, they are your patients who are diaphoretic. Yung common description namin dyan, cold clammy skin. Alam mo yung feeling na namamawis ka pero ang lamig ng kamay mo. Okay, kulang po sa blood sugar yan. Kulang sa Coke yan. Okay, kulang sa soda. Hindi ako nagpo-promote ng Coke. Pagkatapos class, pag consistently greater than 120 po siya, magsususpect po tayo na diabetes mellitus siya. Okay? DM suspect. Suspect po ang nilagay ni sir kasi may diagnostic criteria kami. Tayo pala class para sa diabetes mellitus. Now, that's one of the technologies that we use. But you know what? There are already upgraded CBG machines that allows for network connectivity. Okay, meron po tayong mga CBG machines. Okay, tawag class sa machine na yan is glucometer that allows network connectivity. Tingnan po natin yung example here. Okay, not that one, not that one. This one class. Okay, class. This machine class, no, the same purpose, nagbabasa din ng blood sugar levels, pero by the time na ipapark ko yung machine, okay, or as in ilalagay ko siya class sa parang receiver niya, okay, kumbaga parang telepono na ibabalik mo in place, pagbalik mo class in place, pag-update yan sa network. And then anybody class in the entire network will be able to see already if what is the blood sugar levels of your patient as long as they have access. Okay, that's one trend in technology already available here in our setting. Now, if you would look at this one, ito talaga yung pinaka-main point ng slide. No? Okay, the continuous evaluation of blood glucose levels. Ano pong pinagkaiba? If titingnan po to natin, kay nagpiprick po tayo, the usual order there is that you do your CBG monitoring 3 times a day. Di ba? Yung shortcut for 3 times or yung acronym is 3 times a day. 3 times a day AC. Anybody who can tell me what is the meaning of AC here? Huwag sabihing air condition. Yes, Kathleen.
Before meals.
Very good. No? Your AC here, class, stands for ante-sebum. Or in English, that would mean before meals. So class, yan po yung pag-monitor ng blood sugar usually. Capillary blood glucose levels 3 times a day before meals. Now, so class, ibig sabihin, bago siya kumain, magsasuffer siya muna. Kasi ipiprick mo, di ba? Hindi naman class suffer, exage lang yung word. Pero class, ipiprick mo. So meaning the patient would feel some pain there. Class, for this one, this machine allows for continuous sugar monitoring. Kaya tingnan nyo po ito. Class, ang circle na po ito, class, could stay on that site for up to 30 or even 45 days. Tapos ano pong ginagawa niyan? May needle na po yan sa loob. Ang needle po nakaprick na po doon sa skin ng pasyente natin. Tapos continuously, monitor niya na yung blood sugar levels ng patient natin. So sir, paano? Kukuha pa ba kami ng dugo? Hindi mo na kailangan kumuha ng dugo. Yung gagawin mo lang class, ilalapit mo lang yung device or kahit na ilapit mo lang yung cellphone mo na may application to read this device class, it would already register. Okay? One common brand that I have seen here in our market is what you call your One Touch Libre. Okay? Hindi po yan libre. Okay? Hindi as in libre for free, but the product is referred to as One Touch Libre. Okay? I think plus the point is that you're free from pricks. Parang ganun yung purpose niya. So sir, pwede po bang maligo? Yes, pwedeng paliguan ng pasyente kahit may ganyan. Kaya hindi po yan mababasa sa loob. Pagkatapos pwede bang magtumbling, okay lang. Pag kaya niya, walang problema. Okay? So basically class, ang machine na to or this little device here is only a prick. No? Nagbigay lang siya ng prick papasok sa skin ni patient. It allows for continuous monitoring of blood sugar levels. So, iwas prick si patient natin. Di tulad ng isang device, kanina nag-glucometer, bawat kuha magpiprick. And then class, there's a more recent trend. And that recent trend class is to determine the amount of insulin that is needed by your patient. So ano po yung nangyayari? Once class ma-monitor yung blood sugar levels, pag mataas po, halimbawa, yung blood sugar levels nag 150 mg per deciliter. Mataas, di ba? Yung insulin pump plus right away mag-i-inject lang yan. Sabihin, 2 units of insulin. Okay? So right away nag-i-inject yan. Halimbawa, kapag pareho ka na itong kaklase mo, may sinizip siyang juice or kape man, hindi niya tayo niyayaya, pagtataas po yung blood sugar niya, tapos po ma-monitor ng machine natin, ano pong gagawin? Magre-release lang po siya ng insulin levels. Okay? Plus, that allows for stable blood sugar levels. It allows for stable blood sugar levels. It prevents hypoglycemia. It also prevents hyperglycemia. Sir, bakit problema yung hypo at saka hypergly? Class, kapag may pasyente kayong may diabetes, you will be able to understand that. Okay? Try to look into your patient with diabetes class. Sinasabihan mo sila na bawal kumain ng cake, bawal uminom ng soft drinks, bawal uminom ng mga maraming mga matatamis, bawal kumain ng sweets. Okay? That's bawal to them. Pero class, pag wala naman silang kinain, pwede din silang mag-collapse because they may have hypoglycemia. Kaya wise na dapat minomonitor talaga yung blood sugar levels nila. And one way class that addresses that is your continuous blood sugar level monitoring. Next, we have the term thermodilution technique. No? But thermodilution technique is more on the physician side already. From our end as nurses, please understand that your thermodilution technique is a technique that allows us to measure the cardiac output. Again, class, your thermodilution technique allows us to measure your cardiac output non-invasively. It allows class for the non-invasive monitoring of your cardiac output. Ang naging invasive lang na part nito class is the injection. Other than that, wala na po. Kaya nag-i-inject lang po ng very cold fluid there. That's why class is being referred to as thermodilution technique. One of your nursing responsibilities here is to ensure that the catheter is properly placed. Isang common catheter po na tinagamit natin dito sa thermodilution technique is tinatawag na Swan Gans. Okay? Check ko lang yung spelling ni Swan Gans. Okay, tama? That's your Swan Gans catheter. So class, your Swan Gans catheter is a catheter that would actually end to your pulmonary artery. You write it down that you have your Swan Gans catheter. Your Swan Gans catheter class could monitor the pressure in your pulmonary artery. Okay, yan po yung purpose niya. So, yeah, after the administration of the solution that is used for thermodilution technique class, your Swan Gans catheter will be able to monitor the amount of fluid that passes through there. So in other words, the cardiac output of your patient. Now, most common in our practice is your pulse oximetry. Plus, your pulse oximeter is considered to be a non-invasive method of measuring your oxygen saturation. And that it also uses your spectrophotometry. Okay? So class, tandaan, yung ginagamit na method class is spectrophotometry. Light po is limited through a pulsatile arteriolar bed and then detected by a photo sensor. So class, ang pinaka-common siguro na nakikita po natin is this one, no? Okay? Yan po, yung iniipit sa finger natin na maliit, no? Okay? Usually class, yung mga nurses may mga ganyan na. Kasi sa Shopee PP, parang 300 pesos, 200 pesos, may nakukuha ka namang ganon, ano? So nag-endorse. Class, just be careful of the accuracy of the device if ever you will buy it. Ha? Okay? May mga device po kasi na less accurate. But anyway, for us to understand, no, it works plus by using your photo detectors. Kung kaya, if you would want to have your accurate reading, no, if you would want to have an accurate reading on your pulse oximeter class, dapat do not expose directly to sunlight. Do not expose directly class to sunlight. Once your pulse oximeter is directly exposed to sunlight class, there is a very big possibility na magiging inaccurate po yung reading natin. Ha? So wag niyo po siyang i-directly expose sa sunlight. Okay? Now, plus the normal values of your oxygen saturation is 95 to 100. Other books would say 94 to 100. Other books would say 96 to 100. We can work out 95 to 100. Okay? Sir, ano pong gagawin sa board exam kapag sabi nyo isang libro 94, isang libro 96? Plus sa board exam, hindi sila magbibigay ng question na 94 or 96. Ang ibibigay po nilang number sa inyo is 90, 84 or mababa pa dyan. Okay? Yan kasi yung usual na tinatanong ng mga students. Now class, what else? There is a particular condition wherein class possible na yung reading po natin 100% despite that the patient is actually already grayish or despite the fact that your patient is cyanotic. Okay? Plus that condition is referred to as your, iniisip ko pa. Plus this pertains to your carbon monoxide poisoning. Okay? Condition class is carbon monoxide poisoning. Again, class, I would like to repeat. The reading of your pulse ox in carbon monoxide poisoning could be 100%. However, your patient is actually grayish or cyanotic. Now, sa usual na pasyente natin, halimbawa, if you are assessing a patient with cough, pagkatapos nakikita mo yung patient ineffective airway clearance, expected bababa yung O2 sat. Pag nakita kong isang patient cyanotic, I'd expect that the O2 sat is also low. Okay, I'd expect that the O2 sat of my patient is also low. But if you will encounter a patient na grayish siya, pagkatapos plus cyanotic siya, or either of that, pagkatapos yung O2 sat reading niya class is 100%, one thing that you need to look into is that your patient may have carbon monoxide poisoning. Paano ko po malalaman yung carbon monoxide poisoning? Can anybody tell me where in what incident is carbon monoxide poisoning common? Anong aksidente, saang sitwasyon, very common yung carbon monoxide poisoning? Anybody? Sige na.
Sa mga winter
Factory, sir.
storm, sir. Ay,
Winter storm daw. Yes, Richard.
Sa mga factory, sir. I don't know.
Sa mga factories kasi doon yung carbon monoxide. What else?
Sa ano sir, sa mga car shop.
Car shop? Yes. Okay, that's one very good example, class, sa loob ng car. Okay? Di ba? You are always instructed that if there's somebody left in the car, do not close the car windows, di ba? Narinig niyo yung ganong instruction na part of safety na kapag you are staying inside your car is turned off, do not close the windows. One reason for that, class, is your carbon monoxide. Because your carbon monoxide could enter your car and then plus it could lead to poisoning. Ano pa po? May isang common na accident din or tragedy that would usually cause carbon monoxide poisoning.
Sa mga sunog, sir.
Sa mga sunog. Very good. That is actually the reason why kung tayo po'y nasa isang room na may sunog, paano po tayo lalabas ng room? Nakataas noo, stand still?
Dadoko, sir. Nagkakamang-kamang.
Okay.
Nagkakamang ka, sir.
Yes, very good. You should be crawling. And the reason why you should be crawling is because of carbon monoxide. Plus, your carbon monoxide would be available on the upper part of the atmosphere. So if you are inside a burning room, class, dito yan usually si carbon monoxide. That's why you are advised to crawl so that you will not be able to inhale the carbon monoxide. Ano pong ginagawa ni carbon monoxide? Just for you to have an overview, class, your carbon monoxide has a high affinity. Your carbon monoxide, dear students, has a high affinity to the bloodstream. So pag may high affinity po siya, not bloodstream, sorry, let's correct that. High affinity to the hemoglobin. Okay? So class, pag ikaw po si carbon monoxide, nakita mo si red blood cells na mamasyal somewhere, ano pong gagawin ni carbon monoxide? Instead po na si oxygen yung mag-attach kay red blood cells, aagawin po ni carbon monoxide. Si carbon monoxide po yung mag-a-attach kay red blood cells, wala na pong space kay oxygen. Inaagawan niya ng posisyon si oxygen. Okay? So plus, in other words, it would appear that these hemoglobin are bound. Kung baga, it would appear na si hemoglobin may partner. Ayun pala, class, yung partner niya, kabit, si carbon monoxide. Pero di ba, class, minsan, mas malakas pa yung kabit kaysa sa legal wife. So, ganun po yung story ni carbon monoxide at saka ni oxygen. Okay? Si carbon monoxide na po yung kabit, siya pa po yung nang-aagaw. Parang ganun po yung eksena nila. Okay? Now, so what happens here, no? Plus, the pulse oximeter would read that hemoglobin is occupied. Okay, the pulse oximeter, class, would read that hemoglobin is occupied. Hence, 100% pa rin yan kay pulse oximeter. Okay? So bakit po may ganun tayong discussion? To remind you of the point that you treat your patient, not the machine. Kasi baka mamaya nakacyanotic, halimbawa, nang iitim na yung pasyente. Tapos pag-check mo ng pulse ox, sir, 100% naman, okay ka lang, sir. Tapos magrereklamo yung patient, nurse, nahihirapan akong huminga. Tapos pag-check mo ng pulse ox, sir, 99%, okay ka naman. Sir, wag kang padrama-drama, right? Ayun pala, ikaw na nurse yung naging bobo, ano? So class, be careful, ha? Again, you do not treat the machine, you treat the patient. That's the point that I would like to repeatedly emphasize when we are dealing with technologies. Now, all of those technologies mentioned are nice. Tingnan mo, may cardiac monitor ka na, may pulse oximeter ka, may capnograph ka, may ICP monitoring ka pa. All of those technology are very nice to know. However, class, anticipated problems, alarms. Okay? Alarms. Sir, ano ang problema sa alarm? Class, ano nga ba yung sabi ko sa inyo sa alarm? If there is a machine that would alarm, will I turn it off right away or hindi muna?
Not yet, sir.
Okay? No, di ba? Class, sabi ko sa inyo, pag may narinig po tayong alarm, the next best step that we would do is to assess your patient first before, class, you would decide what to do with the alarm. Kung magstay nga ba siyang on or stay off. Okay? Because, class, alarms were made for a reason. Nag-a-alarm po tayo kasi kailangan po yan. But, there's a very big but na naman. Okay? class, in the ICU, in the intensive care unit, we have what we refer to as your alarm fatigue. Ano po yung alarm fatigue? Ganito na lang guys, think mo na ikaw yung patient, tinatry mong matulog, tapos mamaya lang, beep! Tapos ikaw naman na nurse, nagtatry kang mag-focus sa trabaho mo, mamaya na lang may So class, that concept of alarm fatigue came into picture. Example ko class, tig-isang sound lang yan. Pero in reality, pag may 10 patient ka dyan sa ICU, kadalasan 3 alarms nagsasabay-sabay. That's why class, the concept of alarm fatigue arise. No? Meron na pong nag-aaral tungkol sa alarm fatigue. There are researchers that deal with alarm fatigue. So, what do we do? Or by the way, what's the common cause muna of these alarms? So, blood pressure cuff. Okay, pagkatapos class tourniquet, and then class is your air splints also. They are the common equipment that would alarm. Okay? Ano po yung air splint? Siya po yung nasa background picture natin dyan. Pag sinabi nating splint, di ba guys, ang purpose is to immobilize the joint. Okay, di ba the purpose of the splint is to immobilize the joint. So class, anong ginagawa ni air splint? Plastic po to. Kapag ito po yung joint na gusto kong immobilize, may plastic po na irarap, tapos i-inflate po yung plastic. Okay? Once naka-inflate na po yung balloon surrounding that joint, di ba class, hindi mo na magagalaw. So parang ginamit na splint yung balloon. Okay? Yan po yung tinatawag na air splint. I have not seen air splint pa in our setting, no? Kaya I have read about that in textbooks but not in our setting. But regardless, the main point here is that these 3 are the most common causes of alarms in the critical care unit. So ano pong gagawin mo bilang nurse, no? Anticipate mo lang class na common silang dahilan ng alarm. And dahil common silang dahilan ng alarm class, you assess what could be possibly happening to your patient. And then that's the time that you decide when to turn on, when to turn off. For the alarms, class, take note, no? Nurse spend more time troubleshooting daw and less hours in necessary care. Ibig sabihin, because of the machines that we have, our tendency is that masyado na naman tayong busy sa machine. Si machine na lang palaging inaayos, si machine na lang palagi yung tinitingnan, ano? Wala nang time para kay patient. But how to prevent this? The first step is, kumbaga class, pag bumili kayo ng bagong TV for Valentine's, di ba the first step class is read the manual? Di ba palaging sinasabi, oy, read the manual. Pag may dumating mula sa Shopee, read the manual. Okay? Familiarize the user guide. Learn to troubleshoot, and again, do not turn off the alarm. That's a very constant reminder class na sinasabi sa inyo. Now, pag nasa hospital kayo, tapos feeling mo class yung isang machine mo or yung isang equipment mo is sira, hindi po siya gumagana, anong department po yung tatawagan ko? A, will it be my pharmacy department? B, will it be my central supply department? C, will it be the nursing service office? Tatawag ka sa supervisor mo kasi sira yung gamit. Or letter D, it would be the biomedical department. Palagay nyo guys, sinong department yung tatawagan natin kapag may problema tayo like that? Yes?
Letter D, sir.
Biomedical.
Okay, kasi sir siya yung last sa choices, di ba? Okay, yes, yes. Kadalasan, no? Pagkatapos sir siya yung pinakamahaba sa sinulat mo. Sige, okay, class, that's your biomedical or your bioengineering department. Okay, that was a joke, but you know what? Studies have shown that in examinations daw, teachers has a tendency to make the answer the longest option. Kasi gusto ng teacher niyo na makuha niyo yung tamang sagot. So todo explain siya doon sa best answer niya. Kaya yung tendency humahaba. But anyway, going back to this topic here. So class, no, it's the biomedical or the bioengineering department that you will be calling in case that you would want to have 3 pairs. Right? Then class, you will be encountering the term telemetry. Okay? Telemetry. Class, with the term telemetry, kasi class may met3 nga. So class, there is always measures. No? There is always measures. Ano po yung mini-measure natin in telemetry? Hemodynamic monitoring of your patient class. It can occur at the bedside, however, class, it could be conducted remotely using your telemetry. Okay? So class, When you talk about telemetry, it's remote monitoring. Pag sinabi ko po na remote monitoring, ibig sabihin you are far from your patient, you are distant from your patient, but still you monitor your patients. Okay? Halimbawa, class, kung titingnan niyo po yan, yung sa right side po, those are examples of telemetry nurses. Okay? Telemetry personnel na lang, baka hindi yan nurse yung lalaking yan, ano? Okay? Pero class, ano pong main point? Pag titingnan niyo po yung screen niya, this is one patient, this is another patient, this is another patient, another patient. So ano pong ginagawa ng isang telemetry nurse? According to my colleagues abroad, what do they do, class? Diyan lang sila, nakaupo. Entire 8 hours, maupo ka dyan, tingnan mo pag may abnormal. Pag may abnormal, anong gagawin mo? Tatawagin mo yung nurse in charge. Sasabihan mo, oy nurse, si room 1 mo may abnormality. Habang ikaw nakaupo lang dyan, class, and developing hemorrhoids. Ano? Pero class, in abroad, there are people who are already assigned in the telemetry just for the purpose na mag-monitor ng pasyente sa screen. Pagkatapos, class, imagine that you are in a nurse's station with all of these computers and your patients are across the hallway. Ganon karami yung pasyente natin. So, pag sinabi ko pang telemetry, another way to define your telemetry is that your telemetry is actually considered as a spelling. Your telemetry class is considered as a step-down ICU. Kaya ano po ibig sabihin ng step-down ICU? Pag hindi ka na masyadong malala, pwede ka nang ilipat sa telemetry. Okay? Pag medyo malayo ka na sa kamatayan, let's put it that way, pwede ka nang ilipat sa telemetry. Because you don't need intensive care na. Yung intensive care, i-reserve natin for those who have very severe conditions. Okay? So that's it, class, for your telemetry. Okay, may mga katanungan so far?